medial rotation at the glenohumeral joint. Okay, and then it depends on whether you get your model to present their hand palm down into their pocket or palm up, because that's going to influence which movement.
Pronation.
Rotate, yes. We're not doing pronation because it's not forearm.
Oh,
it's just glenohumeral joint and elbow.
Okay. Yeah.
Alright? Yeah. So it's what's happening in terms of rotation of the glenohumeral joint. Okay? I would normally do that. But I don't care which you do, just as long as you don't get yourself in a mess with what you're doing. Alright? So if we go for hand into the back pocket like that, then it starts in medial rotation, the glenohumeral joint. Then can you see there is more medial rotation there? Up. Before he does that, up. Once more. Okay, so there's also something else going on. What? Abduction and extension and medial rotation. Yeah, so you need to look at it, from all angles, or you might miss the abduction. And it will depend on how the shape of your model as to how much abduction they do or not. So if you've got quite wide shoulders, then they might abduct a lot. If you've got wide hips, they might abduct a lot. Right? So you need to look at it from all angles to make sure you don't miss quite subtle movement. Right? It's easy to miss the abduction and focus on the rotation. Okay, so we've got shoulder abduction, extension, medial rotation. Okay, hang on. That's interesting. Okay. Yeah. Okay, what was I expecting? I was expecting more lateral rotation. Actually, you don't. Alright, and that could be just the position of Joshua's scapula, right? Because his scapula is quite. So sometimes when you do a particular exercise, your scapula is sort of 15 degrees around your shoulder, your thoracic cage anyway. But if you do work out, then sometimes that will change, it will alter the position. If you've got any swimmers in the room, particularly those that do front pull, you might find that their shoulder blades are actually rolled quite forward in elevation as well. Okay, so I think it's a position of Joshua's scapula that means where I was expecting a lot of external rotation, can you see if I externally, that's really not comfortable, is it? No. Alright? So I'm going to do some stretching. Okay? Because he needs to open up his thoracic cage in that direction. We're not really having that today. But that's why you need to palpate, because what you're expecting might not happen. Right? So he doesn't actually laterally rotate, even to put his arm in. If I make him, doesn't like it. Some stretches across your chest. Right. Okay, so he doesn't laterally rotate as expected, he immediately rotates, abducts and extends at the glenohumeral joint, and then go back. The elbow start in slight flexion, more flexion, more flexion, more flexion, and then extension. Okay? Alright, so the muscle work at the glenohumeral joint we've already been through.